Next up is our only action this afternoon, or item this afternoon, which is the Sonoma County Oral Health Update. And with us today is Dr. Lynn Silver-Chaplin to make a presentation.
Mind if I speak from here? I'm short. Good morning, Mr. Chair, members of the board. How do you do this? Thank you. Mr. Chair, members of the board, my name is Dr. Lynn Silver-Chaplin. I am the Sonoma County Health Officer. With me here today is Professor Howard Pollack of the University of California, San Francisco Dental School, a leading expert on these issues who will be available to respond to technical questions from the board. Also Dr. Anthony Fernandez, a community dentist, who will also speak briefly representing our community dentists. I'd also just like to acknowledge the presence of Dr. Newbrin, a resident of Sebastopol, and an internationally recognized expert on this issue as well. Oral health has been a concern of the board for a number of years. The Department of Health Services and its community partners have been working diligently to address these issues over the past few years. In 2008, the board accepted the Community Needs Assessment Report from our hospitals, which identified oral health as a significant health concern for Sonoma County. In 2010, the board directed the Department of Health Services to prepare a fluoridation assessment report. And in February of 2012, the board accepted an update on oral health and directed DHS to continue work on the fluoridation assessment report. Since my arrival in 2012 and through this month, the Department of Health has met in person with members of the Water Advisory Council, community members, business providers, and environmental representatives to discuss this issue. Today, we will ask you to accept an update on oral health and to approve contracts and certain next steps. And we would propose to return to the board again by March 2014 for more final decisions on some of these matters. So today's item, you'll review an update on oral health in Sonoma County. You'll be asked to approve oral health contracts. You'll be asked to approve oral health contracts and next steps to promote oral health and to further analyze fluoridation of Sonoma County drinking water. Poor dental health is a leading cause of preventable illness in Sonoma County children. This is the first finding of the draft report. It's a preventable cause of illness for both our children and for our adults. As a pediatrician, I see that many of my colleagues, from school nurses to dentists and doctors, day in and day out, see the pain and suffering caused by poor oral health. Children in predominantly low-income schools in our county suffer dental decay at twice the rate of children in schools with wealthier children. Even in the wealthiest schools, 1/3 of our children have dental decay, whereas 2/3 of the children in our schools with predominantly lower income children and 2/3 of our Latino children have dental decay. 1 in every 5 low-income children needs early or urgent care. Every day, 10 to 12 children in Sonoma County have to go under general anesthesia with all its risks to treat severe dental disease. Others develop pain, abscesses, miss school, or suffer lost teeth. These are the real and daily health consequences of dental disease in our children that can and must be prevented. They are real and constant dangers, not hypothetical fears. Dental disease is also a serious problem for adults. 1 out of 3 poor elderly Americans has no teeth. Pain, suffering, disfiguration, and expense are the daily consequences of dental disease that can and must be prevented. This is a picture of a college-educated Santa Rosa resident who offered her story. Tooth decay caused her to have serious heart infections twice. She's lost 7 teeth, most of which could have been salvaged but had no dental coverage. She went to various places looking for care but was unable to resolve the issue, and eventually went to a farm workers dental clinic to get antibiotics and have extractions. A group of 5 key actions can help to change this situation. The first is access to dental care. This has been a focus of the work of the Oral Health Task Force. along with many community partners, including St. Joseph's Health, Alliance, Santa Rosa Community Health Centers, Kaiser, and Pediatric Dental Initiatives, which have all created or expanded services. But major deficits continue, especially aggravated by the Medi-Cal discontinuation of services for adults for dental care in 2009. A second key pillar is education. Educating people about good dental hygiene and dietary practice is key. The county is deeply engaged in these efforts together with our partners. Reduction of sugary drink consumption is a goal of our community transformation grant, for example. Dental sealants offers important protection for certain teeth. These effective preventive treatments are being promoted by the Oral Health Task Force, Community Action Partnership, working with Santa Rosa Junior College. However, in 2009, only 20% of our children had received them. Fluoride varnish has been used and expanded in our WIC programs in some of our schools and is used by many dentists. Water fluoridation is the last of these key pillars and yet is only in place in Healdsburg, Fitch Mountain, and Two Rock Coast Guard Center. So a finding of the report is that while all of these are needed and are being implemented, fluoridation is one of the most effective preventive methods, the least costly and with the broadest reach, and yet is the least implemented in our county. We need to strengthen all 5 of these pillars for improving oral health. As a community, we know how and have begun to act, but great gaps persist. Education, dental access, sealants, and fluoride varnishes are important, but do not reach all residents and have limited duration and effectiveness. We must act effectively and decisively as a community to reverse this problem. The second major finding of the draft report is that water fluoridation is a safe and effective intervention with broad population reach. Fluoride is like salt or many other natural substances. None is not good for you, a little is very important for your health, and way too much is not healthy.
I'm going to ask that we all be...
Excuse me. I'm going to ask that we all show some respect and get through the presentation. You'll have your opportunity to speak when we get to public comment. Thank you.
Thank you. The Institute of Medicine has created a fluoride dietary reference or adequate intake and recommends that people consume this adequate intake for fluoride to assure good oral health. For adult males, for example, that's 4 milligrams a day. The Institute also established a maximum dose, above which you should not go. Community water fluoridation aims to help people reach this recommended intake by providing a very small amount below that adequate intake daily. The draft report also concluded that fluoride is safe and effective. Fluoride is a natural mineral found in rock formations and soil and is the main source of both natural fluoride in water and commercial fluoride. In Sonoma County, fluoride is naturally present in our water, ranging, for example, from 0.05 milligrams per liter in Rohnert Park to 0.38 in Sonoma. Community water fluoridation would simply standardize that concentration to 0.7 milligrams per liter, slightly higher than Sonoma. Water fluoridation is also effective. Doing this has been found to reduce tooth decay by 30 to 50% in children and 25 to 30% in adults. These include a large number of well-designed, peer-reviewed studies that have been extensively evaluated. It can reduce lost school and work days, pain and suffering from these problems. Fluoride at the low levels used for community water fluoridation is safe, and the only known other effect is usually mild or very mild fluorosis, usually only noted by dentists and with little functional impact. Experts in fluorosis, for example, some of whose work is cited as reasons not to fluoridate, are fierce advocates for fluoridation and believe that its benefits outweigh any issues around fluorosis. There is also no evidence that community water fluoridation pollutes the waterways or harms wildlife significantly. Fluoride pollution does exist, but where it exists, it is from industrial processes, coal burning, and other issues, but not from the low levels from water fluoridation. As fluoridation benefits have become clearer, its use has continued to spread. In Sonoma County, Healdsburg has been fluoridated since 1952. California law now mandates fluoridation of systems with over 10,000 connections. This applies to Santa Rosa and Petaluma. And California expanded from 28% in 2006 to 58% of people receiving public water in 2012. In the United States, over 200 million people, or 74% of the population receiving public water, receives fluoridated water, which is also used in 25 countries. Fluoridation is also highly cost-effective. While there is an initial one-time capital cost, that investment protects health for decades. The CDC estimates that every dollar spent returns $38 in reduced dental expenditures for family, for employers, for government, and others. California families spend hundreds of dollars each year on dental care, yet many fail to get the care they need because they can't pay for it. Just the cost of the treatment of the children we put under anesthesia each year for tooth decay in this county is similar to the one-time capital cost of fluoridation of our water agency, which would reduce cavities for decades. What are the ethical considerations around fluoridation? In addition to providing significant benefit, one important one is that it can increase social justice by reducing marked disparities in oral health. Some are concerned about choice, but like many public health measures, water fluoridation is a societal decision to prioritize a large public health benefit for all over the ability to choose not to consume fluoride. Similar choices were made for chlorinating the water supply to protect against dysentery and cholera, for adding vitamin D to milk, iodine to salt, or requiring seatbelt use. In summary, the report finds that water fluoridation would benefit residents of all ages, help give our children a lifetime of healthier smiles, reduce disparities in oral health, and save families money. Most major scientific and medical organizations that have reviewed the scientific issues around fluoridation have come out in support. These include over 100 prominent professional organizations. This is just a partial list, but includes the American Medical Association, pediatricians, family physicians, Alzheimer's experts, cancer experts, the World Health Organization, and others. Here in Sonoma County Medical Association, Redwood Empire Dental, the Oral Health Task Force, Maternal and Child Health Advisory Board, Community Action Partnership, St. Joseph's Health, et cetera, and many others are supportive of fluoridation. And the vast majority, about 4/5 of the comments that we received at the time when we closed this board item, had been positive. We have had expressions of opposition from a number of individuals and also from some of the environmental groups and from the Western Price Foundation. And we'll provide those fully to the board, most of which you've received directly. The last key finding of the draft report, which was developed with input from the Water Agency and a survey of water contractors, is that the most beneficial and cost-effective first step for fluoridation of Sonoma County would be to adjust the fluoride level in water at the Sonoma County Water Agency from its current 0.13 milligrams per liter to reach the optimal recommended level of 0.7. This is far less expensive than each local contractor attempting to fluoridate on its own. The Sonoma County Water Agency is the largest water supplier in the county, serving 350,000 consumers in the county. Near optimal fluoridation levels can be obtained for approximately 250,000 residents by fluoridating the water agency. However, the agency is a complex system serving many cities and customers. Accurate cost estimates, discussion with the water contractors who are the clients of the agency and other stakeholders, and development of a financial plan would be the next steps needed for the board to reach any final decision on this issue. So, summarizing, what are the actions requested of the board today? They are the following. The first are for improved oral health in general, to contract with Community Action Partnership for expansion of community-based oral health programs. This will include a pilot of a school sealant programs, support education and varnishes, carrying out of a new Sonoma County Smiles survey, and support the Sonoma County Oral Health Access Coalition. We are also requesting approval for a contract for an oral health education campaign with the Lou Edwards Group. In order to continue the assessment of fluoridation, we ask that the board direct to create the Department of Health Services to create a fluoridation advisory committee, to continue the process of obtaining community input and discussion with the water retailers and other members of the community, with the support of a facilitator from California State University. And lastly, to contract with MWH Americas, an engineering firm, for a preliminary engineering assessment for fluoridation of the water agency system in order to clarify costs. After discussing these findings with the advisory committee, retailers, and others, and formulating a financial plan, we would return to the board by March of 2014 with a final report and recommendations. Thank you for your leadership on this important health issue. With these actions today, the board has the opportunity to begin to lift the heavy burden of dental disease in our community. I want to present Dr. Anthony Fernandez, one of our community dentists, to speak briefly, and then move on to questions. Dr. Fernandez.
Hello, board. Good afternoon. My name is Anthony Fernandez. I'm a graduate of University of San Francisco School of Dentistry, and I have the privilege of practicing for 25 years in private practice here in the middle of the non-fluoridated city of Santa Rosa, the largest city between San Francisco and the Oregon border with no fluoride in the water system. And let me tell you, business has been good. I was asked to speak for 2 minutes, and my wife had the great observation it'd be hard to keep me under 2 minutes. Just reading the list of public health organizations that are in favor of community fluoridation would take 2 minutes. I'm here also on behalf of REDS, which is the Road Empire Dental Society. Some of our members are here. Dr. Simons, Martin's here, and Dr. Greg Milnarchek, my colleagues. And we were very excited by this, by the way. This is like bringing 20th century medicine to the 21st century to Sonoma County, so thank you very much. Just to read the list would take 2 minutes. But anyway, REDS had a meeting recently, and we have over 400 members in the region, and it was unanimous. We're in favor of this proposal to bring community fluoridation. It's about time. As a private practice dentist, I'm the guy with the needle and the drill. I see what happens when people get tooth decay. So, and you know, you're smiling because you know what it's like. It's not fun, and it costs money. The cheapest filling I do is $160. I looked at that before I came. That's for a little one. This costs real money, and water fluoridation is very cost effective. So, the controversy, I was looking at the paper that was there on Friday, and it's not really controversial. The science has been done. We have two of the leading scientists here, my professors, Dr. Ernst Newbern and Howard Pollack from University of California, San Francisco, and you know, they can speak to the science of it much better than I can. Like Dr. Lynn Silver said, fluoride's natural. My hometown of Sonoma, which you represent, hi Susan, naturally has 0.38 milligrams per liter naturally occurring. If you look in the periodic table of elements, fluoride is right next to oxygen there. It's number 9, next to oxygen, which is number 8. Let's see, we're just trying to optimize the level here. That's why we're here. Anyway, the reason why I'm here is I feel, because I'm a professional, I have an obligation to my patients and to my community to speak the truth as best I can, help Sonoma County join the majority of the rest of the cities of California and the nation and bring this public health achievement. It's considered one of the 10 great public health achievements of the 20th century to the good people of Sonoma. Personally and professionally, I hope you guys do the right thing and move forward to promote better health for our citizens. And like I thought, you know, I can't lose in this situation, no matter which way you guys vote on this thing. If you do the right thing and bring this, it makes my conscience feel better. But if you guys fail to fluoridate, you know, I'll be fine. This is, you know, if we fail to act, I thought about this today, I recorded it. This is what. So I'm just asking you, please, let's do the right thing. I appreciate that. Thank you.
It's like fingers on the chalkboard. Thank you very much.
That concludes our presentation. Thank you.
Thank you very much, Doctor. I will come back to the board, but in keeping with our board's certainly our commitment to streamline our meetings and allow for the format that best ensures the most public participation, are there any burning questions of staff before we go to public comment? I think we're good. We're going to go to public comment. We do have now 62 cards for public comment, and again, I'm going to limit it to 2 minutes per person. 2 minutes. And really, if someone has already said something that you would like to say, if you could just come up and state your name and give your opinion very quickly, that would be wonderful. This is great democracy and process, but we do have some rules within our democracy, and we ask for your respect of one another's opinion when they come up to speak to at the dais. And again, you'll have 2 minutes if you want to. If anyone else doesn't have a card in already, I think we have a card from everyone here in the audience. You can bring them over to the plastic bins on the ramp. First up is Walt Mills, Dr. Walt Mills.
Thank you. Thanks for letting me be first.
Okay.
I think Lynn probably has something to do with that. So I'm Walt Mills. I'm a family physician at Kaiser Permanente. I've been in the community for 30 years. I'm here actually to represent the Sonoma County Medical Association. I am the voluntary president this year. And we have nearly 1,000 physicians in Sonoma County. I think it's just perfect to come right after the Dental Association's statement that clearly we support fluoridation in the water. I'm also a clinical professor at UCSF School of Medicine and teach actively at the Santa Rosa County Medicine Residency Program. I'm also on the board for our Santa Rosa Community Health Centers and I chair our quality committee. So there's many perspectives that I bring, but one is I have a brother who's a dentist who lives in a community with fluoride down in the South Bay. And for years he has said to me while I prescribe fluoride to children, what are you guys doing up there? I thought you were really a creative, health-oriented community. And I reassure him that we are going to join the 20th century soon. Most new physicians who come to our community are really amazed to find that we need to somehow or other give fluoride to our children, varnish, etc. I also do a lot of geriatrics, and today I found myself just thinking about coming here today. While I didn't bring a drill or anything like that, or photos of the people's mouths I got to look in, you know, I saw 3 people who were seniors who did not have teeth. I also personally in the last month participated with a patient who is being treated for endocarditis, a heart infection that Lynn alluded to, different patient because of poor dentition. It's really a very serious thing. And the U.S. Public Health Services recommended fluoridation 50 years ago for all our communities. Yet we remain one of the few, certainly this size, and I didn't realize it was actually a law that we need to do that. So speaking for the physicians of Sonoma County, you know, we really do feel social justice is at the core of this. And
Thank you very much, Doctor.
life will be better with teeth.
Thank you very much. Dan Juros?
Driver dangerous, call me dangerous. My educational background is Santa Rosa JC, Berkeley, Stanford, and Caltech. Sodium fluoride's effects affect everybody negatively. Pets, children, and women the mostly, obviously. Any intelligent, rational, common sense person would go with the non-criminal approach, which is community outreach, education, and low-cost dental and care, low-cost dental examinations and care. The most successful use of sodium fluoride in the past has been by the Nazis in the concentration camps. Sodium fluoride, Harvard School of Dental Health. Research proves that sodium fluoride has a direct link between osteosarcoma, which is bone cancer, in teen boys between the ages of 5 and 19. They will suffer an increased rate. The dental health will also found fluoride exposure levels common in both U.S. and British water supplies are consistent with strong and definitive data that the compound can cause severe cancers you now have been informed of. Fluoride is a scientifically proven poison and carcinogen. Calcium fluoride and sodium fluoride, 2 completely different things elementally. The Penal Code 347 of California states anybody that basically pours a poison into the water supply, including anybody, political, administrative, or otherwise, is liable to be accused and prosecuted under as a felony offense. Any violation can result in prison time. California mandated a water fluoridation program back, I don't know how many years ago, but it was never funded, so the legal loophole is it cannot legally require it. This leaves the choice up to the cities, and because of this often overlooked and very small but very important legal detail and loophole, any city attempting to fluoridate the public water supply may be sued at the local and state level. All known legal actions against water fluoridation have been judged in the favor of the plaintiff, and all cities have been held liable for the monetary judgments. And so anybody with political aspirations, that's what you're going to be associated with.
Thank you, Dan. Again, let's do the hands thing so we can get out of here before midnight. Esbon Jen?
Dear members of the Supervisor Board, I'm Esmond Jen. My doctorate's in public health and so is my master's. I'm here to advocate for the health of the young children. I worked as a consultant for the U.S. State Department in East Africa where great percentage of the kids died before they were age 5. And when I came back, I taught at a master's and doctoral level in public health. I've seen what has happened when the oral health is not taken care of. And I also helped start the dental hygiene program at the junior college. And I'm also the dental coordinator for the Santa Rosa Sunrise Rotary dental outreach clinics here. And so I've taken students I take students to Mexico, Ensenada. The first time we were there, we were all kind of shocked because I wasn't there before, and we were expecting major dental issues. There were a lot of plaque, calculus, but not decay. We couldn't figure this out, and then finally we asked some of the local folks, and they said, the water here is naturally fluoridated. If it weren't for the natural fluoridation of the water in Ensenada and La Misión, there would be major, major issues there in Ensenada. So we just worked on education and cleaning the teeth. And we also go to Nicaragua with my Rotary Club and work with the population there. They walk 3-4 miles a day and wait for all day long for dental work. And if that water was fluoridated, that would not be the issue. Now, some of the speakers before me said there are other ways to do it. I feel like we need to use all facets to make this effective. We need to have low care, we need to have fluoridation, topical, and everything. We need to have a multi-pronged approach. And from a more personal standpoint, my brother, who's a pharmacist and chemical lab scientist, when he started having kids, he said, what shall I do? The water in Salinas is not fluoridated. I said, take fluoride pills. And out of the 3 kids, there's only 1 cavity. So I'm just saying it works, and none of them are brain damaged. Seriously. One's attorney, one was valedictorian of her class. And the other thing is, we have to be very careful how we use the term, poisonous. How many of you, I'm not going to have you raise your hands, raise them internally, how many of you are against vitamin A? If you take too much vitamin A, it will kill you. I guarantee it will kill you.
Thank you, Doctor. Appreciate that. Susan Cooper?
Good afternoon. My name is Susan Cooper, and I am a dentist, and I have lived and practiced dentistry in Sonoma County since 1978. The last 5 years of my career, I have been working in community health. As examiner for the 2009 Sonoma Smile Survey, I saw firsthand the faces of the oral health crisis in our county. And what I saw still haunts my dreams. Young children with swollen faces, students sitting in class in pain with multiple abscesses, adults, the medically compromised, and our elderly with no place to get severe and life-threatening dental problems taken care of. Currently, Sonoma County does not have the infrastructure or the manpower or the funding to provide preventive support to all county residents using preventive strategies alone. Strategies such as Dr. Silver mentioned, the 5 pillars: good oral hygiene education, healthy eating and drinking, sealants, and fluoride varnish. It is difficult to get human beings to change habits, even when they know they should. Look at smoking, for example. Every cigarette pack carries a warning label, and still people smoke. As a dentist in the county for so many years, I tried to get my patients to change their oral health habits, and I was successful in some ways, but it is difficult to get people to change their habits. Our most consistent and far-reaching tool to combat cavities is water fluoridation. It doesn't depend upon individual commitment to behavior and lifestyle changes, which we know is difficult for people to consistently implement, even with the best intentions. Due to a number of socioeconomic barriers, not everyone has access to high-quality preventive care. As one of the most scientifically researched ways to prevent cavities, fluoridating the water would help break down overwhelming obstacles. And even though the initial expense seems high, in the long run, it is still the most cost-effective preventive strategy we have compared to the high costs we currently pay to treat this potentially life-threatening disease.
Thank you, Doctor.
Thank you for your consideration.
Howard Pollack?
Thank you, Mr. Chairman, members of the board. I am thankful for the opportunity to provide some more information about water fluoridation and support of it. My name is Howard Pollack. I'm a practicing dentist and a diplomate of the American Board of Dental Public Health. I'm a clinical professor at the University of California, San Francisco, and chair of the Fluoridation Advisory Committee of the California Dental Association Foundation. I'm also an expert spokesperson on fluoridation for the American Dental Association. Just want to point out that a fluoride ion is a fluoride ion is a fluoride ion, no matter what fluoride compound it comes from. 20 years ago, I was the principal investigator of the California Oral Health Needs Assessment of Children. We produced this thick report at that time. A survey of more than 6,600 school children that provided data on the relationship between fluoridation and tooth decay, among other things, in the 1990s here in California. At that time, more than 90% of children were using fluoride toothpaste, and frankly, we didn't know what we would find. We focused only on children who were lifetime residents, taking into account age, ethnicity, poverty status, parental education, the number of parents, whether a dental visit had been made, fluoride supplement or fluoride rinse use, presence of a sealant, and the sampling design effect. Among the children from poor families, those living in suboptimally fluoridated areas, in grades K through 3rd grade, had 38% more tooth decay than those children from poor families living in the optimally fluoridated areas. Among 10th grade students, there were 5 times as many with urgent dental needs in non-fluoridated areas compared to fluoridated areas. Our data here in California demonstrate the need for fluoridation of all public water supplies. Just last year, the California Office of Environmental Health Hazard Assessment reviewed all the evidence and concluded that fluoride does not cause cancer. That is just one example of the fact that we are constantly reviewing the latest scientific evidence on fluoride.
Thank you very much, Doctor. Deborah?
I've got to say, I wish I had a PowerPoint. I think you should allow all of us to present what people look like when they're dying with fluoride. So I want to tell you that, first of all, the information presented by these doctors is all through Rockefeller Foundation, and you're wrong. I will tell you that hyperthyroidism is one of the largest obesity problems as a result.
Deborah, if you want to, Deborah, you're speaking to the dais.
We're fat and overweight.
Deborah, you're speaking to the dais.
I'm speaking to the dais.
Keep
Thank you
your
so
remarks
much.
up there. Thank you.
Hyperthyroidism is a leading cause of illness in the United States as a result of fluoride. They talked about the 5 pillars of health and the consensuses of the various associations that support it. Well, let's talk about the illnesses that occur. We're talking about allergies, Alzheimer's, shock, anemia, asthma, arthritis, autism. We're talking about back pain, behavioral problems, birth defects, blind spots, body temperature disturbances. The list goes on and on and on, and it's a very sick list. We're talking about the Harvard study, too, that says that fluoride lowers our IQ. So when did we start sacrificing our brains for our teeth? I want to know that. This is a reality. You are listening to people that are behind stakeholders. We're talking about big pharma. We're talking about people that need to dump toxic waste byproducts in the water supply because it's too expensive to inject it in the earth where it should be gone if they're going to try to get rid of it. The solution to pollution is not adding it to our water supply. The countries overseas that are not allowing it is Germany, France, Austria, Switzerland, the Netherlands, Northern Ireland, China, Japan, Sweden, Finland. 98% of Europe has either banned or removed fluoride due to health concerns. These people, absolutely, the dentists are dying around their mid-50s because of all the toxins they're throwing in our mouths. Mercury and fluoride. They don't live very long. Check the statistics. It's a fact.
Thank you, Deborah. Wanda Tapia? Okay, once again, 2 things. I have the clock up here. I know how much time there is. I don't need you to announce when the clock turns red. And the other thing is, and I can't tell you this again, please don't clap, because all we're going to do is stay here that much longer, or we're going to go to 1.5 minutes and have that much less public comment. So if you want to have your time up here for 2 minutes, please don't clap. Do this. It's really easy. Thank you very much. Wanda Tapia. Wanda's not here. We'll go to, I just have Lou.
Hello, my name's Lou Montgomery, and I am concerned about the toxicity of fluoride. My initial research uncovered that the fluoridation program consists of byproducts from the phosphate mining industry, hazardous waste considered too toxic to be dumped by the EPA, sodium silicofluoride, and hexafluorosilicic acid. But rather than go into what is so alarming about that, I decided I would call my dentist, Mary Ellen Chalmers, who practices here in Santa Rosa, what her opinion of fluoridation was. And she does use it topically on children from 0 to 12 because it's only effective on growing teeth. But her opinion is anti-fluoridation because in her opinion, there has been no evidence that systemic ingestion of fluoride does promotes oral health, but in fact, in her opinion, it is the mass medication of the population with no evidence that it is effective. She's researched this very extensively. She would have been here today, but had a prior commitment, so she said that I could quote her and speak on her behalf. So the research that I have done does speak to reduced IQ and enormous toxicity, that when these pollutants were released in smokestacks in the phosphate mining industry, all the surrounding livestock was killed. So they had to come up with a new method of getting rid of these chemicals, so they're being dumped in the water systems throughout the country. And I think it's a huge scandal and deserves close re-examination. Thank you.
Thank you. Sherry Creekmore?
Excuse me. You called Lou and she came up. My card was submitted as Lou.
Well, her name is Lou as well, and if you want to differentiate yourself, maybe you should put the last name as well on there. You can fill out another one.
Was it only Lou?
It's only Lou.
Then that's Lou.
No, we're not going to play that game. We have Sherry Creekmore. You can fill out another card if you want. I'd go for both names.
My name is Sherry Creekmore. I'm the school nurse working in one of the neediest areas in Santa Rosa.
Speak to the mic.
Every year I look into the mouths of hundreds of school-aged children in Santa Rosa, and the dental decay that plagues the children in our community is astounding. I would like to share my support for fluoridating Santa Rosa's drinking water because I have seen firsthand how water fluoridation can benefit the health of children. My previous job was working as a nurse for Head Start in Humboldt County, where many children have the benefits of fluoridated water. When I moved to Santa Rosa and started working as a school nurse, I was astounded by all of the dental decay that I saw. I see children all the time with severe decay, rotting their teeth all the way down to their gum lines. One of the children I work with would come to my office in pain every month with a reoccurring tooth infection. His mother would take him to the doctors to get antibiotics, but never followed through on getting his teeth fixed. I realized that this child had a little sister. And when I called her into my office, she too had decay all the way down to her gum line. When I asked her if she had pain, she responded, yes, but my mommy makes my food soft so that it won't hurt so much. Dental decay is not the fault of the children, and yet they cannot advocate for themselves, and that is why I'm here today, to advocate for the children of our community. I support water fluoridation so that the children can have a fighting chance against tooth decay. Of course, water fluoridation will not eliminate dental decay completely, but it will slow its progress and give children's little mouths a fighting chance. I urge the board not to be swayed by negative misinformation regarding water fluoridation, and I believe the board has a responsibility to look out for the health of our community. Thank you.
Thank you. Karen Hudson?
Hi, I'm Karen
Edson, and I'm a retired teacher and new grandparent. And I appreciate your concern for children's dental health. It's very admirable. I too am concerned about that. But by fluoridating our water, individuals are being medicated without their consent. And because people drink different amounts of water, they vary in size, height, and weight. It is impossible to control the dosage that they're getting. The money being spent on this program, I believe, could be better used to educate the public and also to provide fluoride tablets if necessary for families desiring them. St. Joseph's Health System offers a Mighty Mouth program at schools in which dentists check children's teeth and provide fluoride treatments if with parental consent. I'm nervous. I called a few districts and schools before leaving today to arrive here, and I found that the Roseland School District and Preschool, McDowell School in Petaluma, and the Old Adobe School District in which I taught have the Mighty Mouth Tooth Program, and I have seen it in action. In addition, the Center for Disease Control and Prevention stated that fluoride's benefits are mainly topical, not systemic. Swallowing fluoride does not effectively protect your teeth. A study of 39,000 children by the National Institute of Dental Research found that there was an average of only 0.6% difference in the dental health of permanent teeth of children aged 5 through 17 residing their entire lives in either fluoridated or unfluoridated areas. And according to the National Research Council and a 2012 study by Harvard scientists, fluorides have the ability to interfere with the functions of the brain and reduce intelligence.
Thanks, Karen.
I encourage you to vote against fluoridating our water. And
Thank
I
you.
also have something that I want to...
You can give that to the clerk or James Siemens.
Hi, I want to thank the chairman and the board for making this time available. My name is Jim Simons. I'm a periodontist in Santa Rosa. I've been in the county practicing periodontics for over 30 years. Former president of the Redwood Empire Dental Society, former president of the Western Society of Periodontology, representing the western half of the United States. In our board meetings, from time to time, we talk about fluoridation and how we wish it could happen. And many people say never in Sonoma County. And so it tends to be tabled over and over again. And so I was particularly excited when I saw that this, the potential of fluoridation would become reality. I too have seen, although I don't treat children now, but I have seen them in pain and suffering. And I'm really glad that it was individualized so that people can get an understanding of what happens when people have decay. What I'd like to add to it, because I think the science is really rock solid. There's very little question to that. However, I think what's important is to understand that when kids get decay, I talk about the fourth dimension in dentistry, and that's time. And when kids get decay, particularly on permanent teeth, they may get a filling, they may have something put in there. That filling does not last a lifetime. If anybody's lost a filling, had recurrent decay around fillings, basically that means that over that patient's lifetime, that filling will have to be replaced at least once, maybe more, and with the possibility of even being lost. So even though we're talking about short-term damage, I think we have to have a broader term. So I encourage you to have the political courage and political will, even though it's absent sometimes on Capitol Hill. I think sometimes we can have it here. I appreciate your support for Fluoride. Thank you.
Thank you very much. Next up is Martin Van Tassel, and after that will be Alan Friedman. I'll start calling two names. Actually, after Alan Friedman will be Dr. Carolee Shanna? Thank you.
Good afternoon. I'm Martin Van Tassel. I'm with the Redwood Empire Dental Society. I speak in favor of the proposition. I think that the science is well established. I am surrounded by dentists all the time, and I can assure you that this is something that is desperately needed in our county. The Redwood Empire Dental Society represents 80% of all dentists in Sonoma Lake and Mendocino counties, and we are uniformly in favor of this. Thank you very much.
Thank you. Alan Friedman.
Good afternoon. My name is Alan Friedman. Our water district sponsors an excellent public outreach program called Take It From the Tap, which teaches us to choose tap water over bottled water. They gave me this bottle on Earth Day. Adding fluoride will undermine that very program and force us to choose between fluoride and BPA. Regardless of which set of scientific findings you believe, the fact remains that many consumers do not trust fluoridation. Fluoridation will drive many people back to bottled water, and then everybody loses except the bottled water companies. If you want to deliver fluoride to disadvantaged children, then make the pills or topical whatever available through school nurses. But it's irresponsible to randomly dose the entire population. Thank you.
Thank you. No clapping, please. And we got Kirdri, there you go. Thank you very much.
Thank you. I'm a nurse. I've been a registered nurse for 42 years. I'm married to a Harvard-educated physician. And I would like to say that I'm rather appalled that you're even considering this at this time. Dr. C. Everett Koop, who died yesterday, did many wonderful services to our country, but one of the disservices I believe he has done is to claim fluoride as one of the top 10 accomplishments of the last century. We all know that dental schools are supported by the industries that need to get rid of the toxic substances that are being put into our drinking water. This is not a surprise. This is why Europe, which is a very civilized place, has banned fluoride. In 30-something countries in Europe have banned it. Please do your research, people. This is important. The 5 pillars of dental health: access to dental care education, dental sealants, fluoride varnishes. Everybody in this room agrees on all 4 of those. But there is one. As a thyroid expert, having written 3 books with my husband on thyroid, I'm telling you that you're doing a lot of harm to senior citizens, to thyroid-compromised people, which is 26% of menopausal women, and as we age, it gets to be higher. So you're talking about 1 out of every 4 women. You're talking about the senior citizens of our country. These dentists have seen the effects of oral health care on children. We all agree there is a problem. We do not agree on the solution. Putting toxic substances into our drinking water, why don't we put Prozac in the water too? Because everybody's on it, you know? So basically, this has to be thought through very carefully. Cities have been sued. Cities will continue to be sued. I deeply respect the dentists who are here today to speak their truth. But as a holistic nurse who has certified advanced practice holistic nurse, I have looked at all of this very carefully. When we started writing our thyroid books, I started realizing there's so much research out there. The more research I read, the more I was convinced that this is a very dangerous practice.
Thank you. Naomi Fuchs. After Naomi, we'll have Pedro Toledo and Ann Durham.
Good afternoon, thank you. My name is Naomi Fuchs. I'm the CEO at Santa Rosa Community Health Centers. Our health centers serve over 40,000 low-income, underserved people in Santa Rosa with primary care, mental health, behavioral health, and soon-to-be dental services in this community. Our clinicians see daily the impact of the poor oral health in our community. Children in pain. I've seen young women, 24, 25 years old, their whole mouth all their teeth having to be pulled. Yesterday I heard about a 78-year-old man who pulled his own tooth for lack of access to care and lack of preventive services. People who spend weeks in intensive care because of infection. I think we really understand, we all agree, as the nurse just said, we have an epidemic of tooth decay and oral health disease. This is not disputable. What we must decide is how to treat it, what to do about it. We've talked about education. We all support education. It's not fast enough, it's not effective enough. We need to do more of it, but it needs to be just one strategy that we use. early intervention and treatment, of course, sealants, all of the tactics that we've talked about. We do not have enough dentists in our community to serve all of the people who need care. Our clinic, which will open with 14 chairs in about a year's time, will just touch the iceberg of need in our community. So then we get to other forms of prevention, and I believe that the preponderance of evidence is in favor of water fluoridation for our community as the best prevention strategy that we have. Public health is about doing the greatest good for the greater all, and I urge you to support the department's proposal around fluoridation. Thank you.
Thank you. Pedro Toledo.
Good afternoon. Pedro Toledo with the Redwood Community Health Coalition. We in Sonoma County have an obligation to fluoridate our water. We have a legal obligation from the state, but more importantly, we have a moral obligation because of the lack of access to prevention-focused dental care for our young kids and our teenagers. Thousands of teenagers in Sonoma County went to school today in dental pain. Imagine trying to learn arithmetic with a toothache. Now imagine they are not going to get dental care for 3 months. Thousands of those kids are going to end up at the Pediatric Dental Initiative requiring oral health surgeries under general anesthesia. In a county with so few prevention-focused dental care services, fluoridation must be part of the dental puzzle that this Board of Supervisors must address. It's not the answer, but it's an essential piece of the strategies that we must implement to ensure that more members of our community have a better oral health access or oral health status. No child in Sonoma County should be going to school learning geography with a toothache. Thank you.
Thank you. Ann Dura.
We're all familiar with the old saying that if a lie is repeated often enough, especially by the news media or those in authority, people will start to believe it. This seems to be the main strategy now being used by those promoting the fluoridation of our water supply, including our editorial writer of the local newspaper. Their argument is that the science is now settled regarding the benefits of fluoridation, but nothing could be further from the truth. With just a little investigation, you will find innumerable medical professionals and scientists who have given warnings about long-term health consequences from water fluoridation. Among these are a Nobel Prize in Medicine recipient, past president of the AMA, a senior toxicologist at the EPA, and a state dental director speaking at a conference of state dental directors. A Journal of American Medical Association study has also demonstrated a link between hip fractures in the elderly and fluoridated water. Since 1995, when the state's unfunded and unenforceable mandate was passed, there have been at least 6 studies that link fluoride to neurological impairment and lower IQ in children. This included the poor children who you're now targeting for fluoridation. Several environmental groups are also on record as opposing fluoridation due to its negative impact on plants and animals, as well as on people. Since AB 733 left it up to the cities or counties to accept non-taxpayer funds to implement fluoridation, we're therefore holding you, the members of this board, fully responsible if fluoridation is forced upon us. We're here today to ask you to please reject any grant or funds offered that would add fluoride to our water supply. And we would also like to request further that you enact an ordinance that would prohibit the addition of any substance, including fluoride, that would affect humans physically or mentally, rather than treat the water, as other cities have done.
Thank you, Ann.
It is the mission of the Water District to remove impurities, not to add to them or to mitigate people.
Thank you.
Thank you.
David Smith. After Dr. Smith, we have Stacy Sterling, Gail Hartman.
Hello, thank you for having me here today. My name is David Smith. I'm a pediatrician in Santa Rosa. I've been here since 1977. I fully support the Public Health Department report, and I find it was very comprehensive, much more so than I expected. It's not a one-issue item. So we're not here to review all the scientific data. There are lots of smart people who can do that. And the good thing about science is it continues to be reviewed. So this isn't the end, okay? 70%, I'll try to just hit the highlights, 70% of this country is on fluoridated water, but more locally, we have Healdsburg doing it for 60 years, okay? We have San Francisco just as long. We have the East Bay doing it since the 70s. We have Sacramento, Los Angeles, San Diego, and now San Jose. You know, there are a lot of major universities in those places. There are medical schools, dental schools, and you know, just the population there. There are no slouches as far as scientific or social justice or environmental organizations. So we're not, you know, we're not discovering something new here. Aside from the endorsements by all the major public health and dental and medical organizations here in Sonoma County, the pediatricians group, the medical society, the dental society, and I've spoken with physicians who serve all economic segments. We have the private groups, we have the health centers, we have the Kaiser pediatricians with 30,000 patients in their population. I'm getting low. So what I'm asking here today is that you do what government is really best to do. They can help the majority of the citizens. They can benefit all the citizens, the young, the rich, the old, and the poor, and I ask you to implement this plan. Thank you.
Thank you, Doctor. Stacy Sterling.
Hi, I'm the Dental Operations Manager for St. Joseph Health. I run the Mighty Mouth program, as well as a mobile dental clinic and a fixed site clinic, all for children. Every time we go out and do prevention, we find a bunch more children that need treatment. We're not able to keep up with that treatment, so we have waiting lists of children in pain. Every day we see children with 20 out of 20 teeth decayed. We fluoride varnish every patient. We provide education, prevention. We're not seeing our decay rates go down. We're actually, in some situations, seeing them rise. Our last new patient day, we had 67% of our children with decay. That's just an unacceptable level. Many of the cases are very severe. We had one child that sticks in my mind is a 5-year-old little girl that came in. Her face was so swollen, her eye was almost shut, and her breathing was being affected. So she had taken several buses to get there, so I took her and her family to the ER, and she was admitted for 5 days. Her cost alone for that hospital stay was about $80,000. We see children like this every day. So my fear is that we're going to see a death in Sonoma County for these children that don't make it in time. I've probably seen 5 in the last 8 years that have been really, really close. And I hope we don't get known in the area for being that county that didn't take advantage of the resources we have. Thank you.
Thank you. Gail Hartman. After Gail, we have Ernest Newbron, Ray Morgan, and Kirk Pappas.
Gail Hartman from Oakmont. I seem to be the only person here who is concerned about the cost. As reported in the Press Democrat, $8.5 million for startup, $1 million a year for maintenance. We're told by the Board of Supervisors that we do not have enough money to maintain our roads, which have potholes and various problems. So I'm wondering, where are we getting the money for this project? And I would like to see a breakdown of that in the Press Democrat. I've not seen any reporting on it. The other issue I'd like to mention is that in the 1930s, a Cleveland dentist named Weston A. Price spent 10 years traveling all over the world investigating tooth decay. He went to 14 different countries, Africa, South America, Polynesia, New Zealand, Australia. In every case, he found that the people who stuck to their traditional indigenous diet, whole foods diet, had minimal tooth decay. But when they switched to a modernized Western diet, white sugar, white flour, canned processed foods, that's when tooth decay started, that's when their jaws narrowed. I would like to see more attention paid to the nutritional aspects. I think if you observe anybody in the supermarket, they have their shopping carts piled high with supersized soft drinks, sugary pastries. I think that's at the root of the problem. I'd like to see more attention paid to that.
Thank you. Ernest Newbron?
My name is Ernest Newbron. I'm a Professor Emeritus, University of California, San Francisco, and I'm also a resident of Sonoma County. I've taught dental students for 30 years. I'm past president of the International Association of Dental Research, and I'm also an author of 2 textbooks, one Caryology and one Fluorides and Dental Caries, a standard textbook and reference used by dentists and people in dental public health. You are presented here in a situation where you have speakers for and against, and you might think that this is a 50-50 position. That's not the case at all. A Gallup poll taken of the public has shown that 78% of the population are in favor of fluoridation, 12% are not sure, and 10% disapprove. So these people who hear clapping and showing signs are a very small minority and do not represent your voters or the population of Sonoma County. And you've also heard from Dr. Silva how many health professionals, whether they're medical, dental, or public health, support water fluoridation. And also your local Press Democrat editorial, I think, very comprehensively summarized, as did Dr. Silva, the argument for water fluoridation. The safety of fluoridation at 0.7 to 1 part per million has been well established, and the scare tactics that you have encountered here regarding poison and cancer and the conspiracy theory that has been proposed are totally without a basis. If this idea that dental schools or that professionals are being bought by health by the industry, why is there no industry representative here? That's you would expect that, wouldn't you? I urge you to support this.
Thank you, Doctor. Ray Morgan. Again, I have the clock up here, so we're good.
Hello, my name's Ray Morgan. I'm a resident here. One of the reasons I moved here was this county did not fluoride their water. That was one of the main reasons. I am absolutely in favor of topically treating with calcium fluoride the teeth of children by dentists. Pharmacy grade. Absolutely in favor of it. People who culturally consume soda pop, candy, dulces, poor kids, those people need education and personal dental attention. We're talking about those people, poor kids who have dental problems. They need dental attention and education. Yes, Shirley, those people. We're not talking about the rich kids because they pointed it out clearly. Rich kids are doing just fine. Right. We have poor kids that we need government attention to. They need dental education and dental treatment. The money. My dentist charges $40 for a fluoride treatment. 8.5 million buys 212,500 topical treatments. $800,000 a year. Buys 20,000 topical treatments. I think that's far in excess of the people that we're looking at treating. If we want government treatment of needy patients, tax sugar, refined candy, and soda pop, and fund a dental treatment program. Moving forward with mass application of controversial, dubious chemical compounds to ineffectively treat a small portion of the populace is wrong thinking. That's the same thinking that Sugar causes diabetes. We ought to put insulin in the water. That's wrong thinking. Women have hormone deficiencies in their middle age. We should put estrogen in the water. It's a big part of the populace. Wrong thinking. We've all had allergies the last few days. By gosh, let's put Claritin in the water. Wrong thinking. Fluoride ion is not a fluoride ion any more than a chlorine ion is a chlorine ion. Sodium chloride is table salt. Calcium chloride you would never put on your food.
Thank you.
Do no harm is the first thing. I strongly urge you to do no harm and vote no on sodium fluoride. Thank you.
After Mr. Pappas, we have Marie Mulligan and Pendy Vanderwalk.
Thank you, Mr. Chairman. Good afternoon. My name is Kurt Pappas. I'm a physical medicine rehabilitation doctor, and the board is more comfortable with me speaking about exercise and other broader health issues. And the science is beyond my area of expertise. I speak to you as you are a senior leader and responsible for the lives of hundreds of thousands of people. I'm responsible for over 150,000 lives at Kaiser Permanente, and as someone appointed by you to Partnership Health Plan Board, another 50,000 lives. So I'm personally responsible for over 200,000 lives in this county. I fully support Lynn's presentation and all of the 5 parts of this issue. They are important to improve the public health of our community, improve the health of our children, and everyone who's living in this community. I really think that what you have today is a question of both oaths, mine and yours. How do we help our community be more self-sustaining? And clearly, what Lynn is recommending fits within that. And within what we're all trying to do is to improve the health of the communities around us, which we do at Kaiser Permanente and which you do as senior leaders. I can't thank you enough for taking this on, and I strongly support all of Lynn's recommendations. Thank you.
Thank you. Marie Mulligan?
Good afternoon, Mr. Chair and members of the Board of Supervisors. My name is Mary Mulligan, and I'm Medical Director of the Santa Rosa Community Health Center's Lombardi Clinic, the original Southwest Health Center serving the Roseland community. I'm responsible for the lives of 17,000 patients, and today I'm coming to you as a physician. Every day, clinicians in our clinic see the mouths of devastated mouths and devastated lives. I've been a physician for over 30 years. I've been a physician in this county for over 20 years, and I've been serving the underserved for 7, which is a privilege. I can tell you that the mouths of the children and adults I saw in Berkeley, where there was fluoridated water, were different, very different from the mouths we've seen here in Sonoma County. And the mouths of the patients that I cared for at Kaiser Permanente look very different from the mouths of the children that I see here every day in clinic at Roseland. We're not talking about a small number of people, we're talking about thousands of lives. I want to tell you one vignette. It was this academic year, a young boy came to me, school-age boy, with his concerned mom. She was here because a teacher believed that the child might have attention deficit disorder and needed a workup. Part of the care of this boy included a full physical exam, and on seeing this boy's mouth, it was clear he had horrible dental decay. With extensive repair under general anesthesia, his academic reports returned. He lost months of learning. Please, I would urge that you support the Public Health Department's efforts to advance further investigation of what we can do to prevent dental decay. Thank you.
Thank you very much. Penny Vanderwalk.
Good afternoon. In the interest of time, I've abbreviated my remarks from 3 pages to 1.
Thank you.
You're welcome. So I really just want to make 2 points. I'm the Development and Community Benefit Director at Sutter Medical Center, but in a former life, I was a clinical social worker. And one of the distinct memories I have is of children who had to have surgical treatment of dental caries. Before the PDI Surgery Center opened, Sutter provided the vast majority of these surgeries. And I remember countless children, many of them as young as 3 years old, being wheeled down to surgery in the little red wagon and clutching the teddy bear that we gave them for comfort. but in such severe pain, and knowing that even after months of pain, they're going to have even more pain associated with an invasive procedure. It's heartbreaking. But I also want to say that there's really some good news. I'm proud to be part of a network of committed health and social service providers in this community that are really dedicated and are doing a lot, as has been illustrated here today, to address the issues of prevention and community awareness and providing services to the many, many children and families who have very little access to dental treatment. But as you can hear, lives are at stake, and while we are doing our best, it's not enough. And I actually agree with Mr. Morgan that perhaps we should levy a tax on sugar products. That might actually help us move the dial a little bit faster. But we need you, and I urge you, Board of Supervisors, to join us in making an even greater impact by making the courageous decision to fluoridate our public water supply. Thank you.
Thank you. Meredith Krishnik? Krishnik, there you go. After Meredith is Rio Molina and Vivica Radal.
My name is Dr. Meredith Kishnik. I'm the Medical Director of Roseland Pediatrics and Elsie Allen Health Centers, and I represent Santa Rosa Community Health Centers, and we have 12,000 children. And I do represent those children that we are talking about here. And those people, and I feel strongly about those people are our people. I am an oral health champion. I brought toothbrushes to my clinic and all the clinics. I brought fluoride varnishes. Recently, I'm one of the only clinics in Northern California that has an independent dental hygienist working side by side by a pediatrician. And we're starting to do oral health care at the age of 6 months. Believe me, prevention is not enough. The 4 points that we all agree upon is not enough, and fluoridation is going to be paid for very quickly by the preventative effects of fluoridation and not paying for surgery for these children. It's 5 months to get a dental appointment in this county if you're on the dental cal waiting list, and as a child with dental cavities and pain, that's too long to wait. And quoting another Surgeon General, Jocelyn Ehlers, you can't educate a child who isn't healthy, and you can't keep a child healthy who isn't educated. So thank you.
Thank you. Rio?
Hopefully I don't get thrown off this time.
We're all good.
So I read a quote from Dr. Alan Bernstein, the Press Democrat, and he said that there's never an absolute answer, especially on medical issues. This practice you're forcing on us seems absolute, which definitely violates scientific ethics. If fluoridation is one of the greatest achievements in the 20th century, according to the CDC, I'd expect to see the Tuskegee incident to be on that list as well. The risk of general anesthesia on children undergoing surgery for tooth decay is a manipulative reason to expose the entire population to a substance whose safety is still in question. I think the real misinterpretation of science here lies in your concern about the theoretical hazard of the risk associated with tooth decay. Hexafluorosilicic acid and its salt are not naturally occurring compounds. The doctor even admits that the fluoride ion is the active ingredient in fluoridation, so wouldn't that make it medication regardless of what the IOM says? She even admits that the children should not use fluoridated toothpaste, so I'm wondering why would we add it to the water? Not everything that occurs in nature is necessarily safe, so I don't think recommendations for diet should take the form of mandates and expose people to stuff against their will. Water is a macronutrient. Fluoride is supposedly a necessary nutrient at certain doses. Comparisons of the two are nonsensical in terms of chronic toxic dose and a lethal dose. Oxygen is not a nutrient, so you can't compare it to fluoride in saying too much is bad and just enough is the right amount. Breast milk does not contain significant amounts of fluoride, way lower than 1 milligram, so as a result, formula-fed babies may ingest more fluoride than is safe. Are you going to encourage mothers to breastfeed in your attempt to control our diets? The doctor admits social inequity plays a significant role in contributing to poor oral health, yet the position you advocate does nothing more than promote inequity between those who abuse their power and the citizens who are supposed to hold them accountable. Your use of taxpayer funds for unnecessary studies attempting to allocate more money for something many oppose to real infection that needs treatment. It's not good for you, neither is promoting social inequity.
Thank you. Vivica Rydell.
Good afternoon. Thank you for your time. Since you already have the letter from the PDI Surgery Center, sorry, I'm Vivica Rydell, the tooth lady from the PDI Surgery Center. You already have the letter explaining kind of the support of PDI Surgery Center for all the efforts that we need in the community to really shed a spotlight on what's a hidden epidemic. The Surgeon General called it really a silent epidemic of severe tooth decay. So the latest numbers that I have for you right now is that since opening January 2008, the PDI Surgery Center, which is the 2 operatory room surgery center here in Sonoma County, where the children that do need general anesthesia go, or children who need for developmental disorders for some reason need to be put under general anesthesia. To date, we have treated 8,226 children from January 2008. From Sonoma, that's 3,690, basically 4,000 kids. Just to compare, last year we saw 159 kids in January, and now we saw 184 last January. What we've seen over the 5 years is that the demand for the surgery has increased. We started serving 3 counties, now we serve 30. We used to only serve families that were on Medi-Cal. Now many of the families that we serve were on private insurance 5 years ago, but now they're on Medi-Cal because of the economy the way it is. And we also see that the amount of decay has increased. The kid that came in on average when we opened was a 3.5-year-old with 6 cavities. It still hovers around the 3.5-year-old because we serve children, but it's now up to 11 cavities. So what I want to urge you is just anything we can do to increase the awareness of the multifaceted approach so that we can address the oral health crisis, including also the campaign and the public awareness about this issue. Time and again, we're being faced with people saying, well, I have heard of cleft palate, diabetes, obesity, but not this. So please help us shed a light on that on all facets. Thank you.
Thank you. Krista Gabriel. After Chris, we have David Smith, Greg Malinarczyk, and Jim Jorson.
Thank you, Supervisor Rabbit and other supervisors. My name is Chris DeGabriel. I'm the General Manager of the North Marin Water District. I'm also the Chair of the Technical Advisory Committee to Sonoma County Water Agency. My comments today are solely my own, since neither North Marin Water District Board of Directors nor the Water Advisory Committee or the Technical Advisory Committee has had an opportunity to collectively review today's staff report or the Sonoma County Fluoridation Assessment draft report. I did attend Friday's public meeting at the Sonoma County Department of Health Services, and I was pleased to learn that the department intends to update the Sonoma County Smile Survey completed in 2009. And I do have some suggestions on how that survey may be improved, so I'd be happy to offer those to Dr. Silver if she's so inclined. I'm also pleased to see that the staff report for today's action item indicates that none of the recommended actions will have an immediate cost impact on the water agency or the water contractors. With regard to the fluoridation assessment draft report, it's my understanding that Sonoma County Water Agency is a public water system and is subject to the California Health and Safety Code provisions regarding fluoridation of its water supply. North Marin Water District, therefore, and I believe the other contractors understand that the capital and operation and maintenance costs to fluoridate the water supply cannot be funded from water ratepayers or taxpayers from within its water system. Fluoridation of the water supply is always controversial, and you're hearing that today, and you've heard that a year ago when this was first considered. Prior to enactment of the 1996 Fluoridation Act, many boards and councils asked for a community vote to decide the matter. That's what happened at Marine Municipal in the early 1970s.
Chris, can I have you wrap up?
Yep. The act took the decision out of local providers' hands. Now, if sufficient outside funds, such as from federal block grants or donations from private foundations, are available, the public system must be fluoridated, notwithstanding any objection by the water system contractors.
Thank you. David Smith? I think he left. Okay, Greg Malazarzik? I was trying to say it really fast, so you
know, it's one of those
get the
burdens
butcher
you carry. So, yeah, hi, I'm Greg Monarchek. I am a practicing dentist. I've been here for 39 years, and it's been a privilege to be here and work here, and I've seen many, many children. And we all know that. We've all heard the stories. I did something a little different. I've had the privilege also of being on the professional advisory board for a couple of rare genetic diseases. So I get to work with just brilliant people. I think I'm there for entertainment, but mostly they come from all over the world, and we're just in Washington, D.C., and there was 60 of them. They're from Oxford and Cambridge and the Swedes and the Netherlands and, you know, of course, Harvard and Stanford and all that. These are just brilliant people. They're working on these really difficult diseases that have tremendous impacts on people's lives. And they get big-time grants, huge amounts of money, large laboratories funded by Harvard, and they work for years, and they're so methodical, and it's just, you just can only admire the work that they do. The point will come in a second. The amount of money, and then they find a drug or a treatment which helps 25%. Or, you know, the patients that have this disease, it'll help them 10%. Or it'll give them some hope. And then I look at fluoride, and I just go, my God, this is a gift. This is just a freaking gift. It is, I don't want to say no-brainer, but I'm going to say it's such a no-brainer. You can do so much good for so many people for so little money. Oh my God, if my friends in the UK could, you know, look at from their labs and go, you're not doing fluoride? You gotta be kidding. So anyway, thank you so much for looking at this issue. I know you've had a huge day. This is a big one. This will make a huge difference. Thank you so much.
Thank you. Jim Jorson?
I look at this from a different standpoint than most, I think. I think the whole fluoridation issue is pointless to me because children and young adults are the biggest concern with tooth decay. And from what I've seen and gathered from information, it seems children don't drink much water, if any. It's mostly soft drinks and that sort. So it seems to me if fluoridation was beneficial, it wouldn't be helping the targeted population of children. The information that I do have, fluoridation is mostly negative, and it may be toxic and long-term effect on the body. I am totally against fluoridating the water. We could use this money for education of oral hygiene and other educational needs. I feel this would benefit the society much more. And I think this whole issue of fluoridation, I feel is, this whole fluoridation thing smells rotten to me.
Thank you. Michael Hilbert. After Michael, we have Elizabeth Van Dyke, J.K. Carmen, David Fier.
Yeah, I'd like to see you do something in the interest of bringing more affordable basic dental services to people who want to pay, but they just can't afford it. And that way, you wouldn't have these long waiting lists, the Medi-Cal, free clinic type operations. They claim they're being overwhelmed. I know, for instance, that Vineyard Dental on Sonoma Avenue offers a lousy 10% discount to uninsured cash-paying patients. So a crown, instead of being $1,200, would be something like $1,080 if you wanted to pay cash at the time of service. You can do something more creative and try to get people so that they can afford to get their teeth cleaned and get a basic exam. I think they want over $200 for just a basic cleaning, and they'll probably spend less than 15 minutes on you. And also, I'll make another observation. If you look at these middle schools like Cook and Comstock, you see that when they let out at the end of the day, they're set upon by these Mexican junk food vendors in their three-wheel carts with all their garbage that'll rot your teeth. I mean, if these medical professionals had a little more energy, maybe they might consider doing something about that. I saw some overweight middle school girl get a cotton candy and eat that as an after-school snack. Now, I mean, if someone's going to choke down a cotton candy as a snack after school and not brush their teeth, maybe there could be some benefit to fluoridating the water, but that's not a legitimate reason to do it.
Elizabeth Van Dyke.
Hi, I haven't addressed this board in a while. I think Ernie was here last time I spoke to this board. I'm here today to represent the great unwashed on the lower Russian River, whose drinking water is drawn from wells and groundwater fed from the river itself. I raised two sons there. They're 26 and 28. I think they have 2 cavities between the 2 of them ever. But of course, there was no soda in my house, and I fed them real food and all of that kind of stuff. Sorry, let me take a look. Into our groundwater lands all the hormones, psychotropes, antibiotics, antiretrovirals, pesticides, fertilizers, and God knows what else. So when you think about adding the fluoride to the water systems around the county, and I read the report, so I realized that we're on the list somewhere down the line. I know that Sweetwater Springs is on the list, and so I want you to think about the ultimate dose we're going to be getting down there. Jenner, probably far worse. And that's going to be provided to my community. I'm assuming that this will be necessary because our roads will be so bad by that time that we'll no longer be able to drive to the dentist. A wee bit of arithmetic would indicate that 8,000 to 10,000 children per year could have their teeth cleaned for the million-ish that you're thinking about putting in. That's not even about the upgrades. I believe you're behind the time, folks. Behind the times. The trend from 1972 to 1970 through 1992 in Europe was to remove this toxin. Why do we need it now? For the fish, maybe? Thanks.
J.K. Carmen. After J.K., we have David, is it Fier? Tamara Davis.
J.K. Carmen, Santa Rosa. I support what the others have had to say. I think this has been covered very well, and it's the person that said never, no fluoride in Sonoma County. We have a pretty pristine water supply here compared to a lot of other places. We have the minimal amount of whatever it takes to keep us from getting the parasite infections like they had Giardia in Tahoe, or chlorosporidioses in Atlanta a couple of years ago. My husband was a water engineer at the Sonoma County Water Agency for 17 years. He was also the agricultural engineer for Valley of the Moon, so I had an opportunity to interface quite a lot with the water agency and what was going on with the farmers, etc., the things that go into the water. Also with the casino. The casino is a threat to the water tables from what I've read. We have threats from all sides to our water. We have a very special situation here in Sonoma County, and we owe that to the people that have kept it this way for as long as they have. I've lived here since 1960. I have 2 children. My son is 24. He had a cavity before he was 18. He had 1 cavity when he was a little older than 18. And he grew up here and he never had any problem. My daughter, the same. He was also a graduate of college, my daughter also. And, you know, what I can see here is this is being pointed out by a lot of people. These kids are having problems. They are having problems, and it's very serious. It's like third world problems. My husband went to Indonesia as a water engineer. I saw real water problems in Indonesia. And also, when the water, once you do this, there's no going back. There's no turning back. It's not going to save kids from getting cavities. Kids are still going to get cavities. They're still not going to brush their teeth. Their parents are still going to be too ignorant to take good care of them. And there's none of these people here that I see. I don't see anybody. Is anybody here that has these children that all these people are talking about? It's very tragic to think that we're going to do this to our water supply. When I moved here, you could go to this spill off of Calistoga, put your bottle up, and take the water off the mountain.
Thank you.
And it's not that far from it at this point. No fluoride in Sonoma County.
Tamara Davis. After Tamara, we have Art Koenig, James Bennett, and George Hubert.
Hello there. Thank you, supervisors of the board, for being here and listening, respectfully listening to all of us today. I've listened to the presentation. I've listened to dentists. I've listened to the other side, and I have one thing that I'd really like to point out to the board. This is a real look at dental fluorosis. Okay? For everybody back here, this is a look at dental fluorosis. Now let me ask you one question. Who do you think that benefits? Who does that benefit? That benefits the dentists, because they have to go back in and repair these teeth. Okay? So that being said, let me just introduce myself for a moment. I moved to this county because it had no fluoridation. When I came here, I came from a world of finance. I was in investments. I worked with a team of investors. And I had to tell you, I looked over the report that was written here by Lynn Silver, and I apologize if I bastardized your name. And this report, if anything, is thin and fluffy, to say the least. And let me point out a couple of the issues that I'm talking about in the report. Exactly. If you go to page 2 and 4 of the report, it states that they are concerned about the poor and people of color and their health, and the Black and Hispanic children of our county. Well, let's see what the League of Nations has to say about that. The League of Nations has to say it's the oldest Hispanic civil rights organization in the United States. On September 11th, they passed a resolution opposing fluoridation in its annual conference, okay? So then after that, we have Andrew Young, who is also an Atlanta mayor and a UN ambassador during the Clinton administration.
Tamara, you got to wrap it up.
All right, I'll wrap it up to this point. We have, let's talk about the risks. Risk to the brain, risk to the thyroid, risk to the bones, risk to the bone cancer, risk to kidney patients. We have the Centers for Disease Control stating that it's not systemic. We have the American Dental Association that advises parents on avoiding giving babies fluoride.
Thank you, Tamara.
We also have,
Tamara, your time's up.
not only we have the
Tamara, your time is up.
We have
Sorry,
the world
your time is up. We want to be fair to everyone who's here. You don't get any more or less than anyone else. Appreciate your comments and your passion, but your time is up. David Fair, I'm sorry I missed you on the last one.
That's all right. What I would like to state is that I have original also documents
Tamara,
I'd like
you're
to
going to be
actually
escorted
assist
to your
with.
seat in a second. Thank you. We are a democracy. Everyone is equal. Thank you.
Hello, my name is Dave Fury. I'm a 37-year resident of Sonoma County. Raised 2 children here, born and raised. Between the 2 of them, I reflect the same some of the other speakers. They've had 3 cavities between them. I was responsible for their dental care, not the city, not the schools, not the county. So, and I have another issue that responsibility is one of them, but I have a question on when did the board become responsible deciding who, when we're going to be fluoridated water? If I remember correctly, 25, 30 years ago, we voted as a citizenry whether we should have fluoridation in the water. So I don't know what's changed now. I would hope and expect that we will have that same option of voting in the near future, whether to fluoridate the water or not. Thank you. I think that's an easy solution.
Thank you very much. And I will say, Tamara, if you did have something to drop off, please do. You can give it to the clerk. Art Koenig, just so you know, we're probably a few cards more than halfway through. We're having fun.
I'm against the adding of fluoride in our water system. I have 4 grandchildren, ages from 3, 6, 9, and 12. My daughter and son-in-law do not permit them to have any soda pop. They do not have any cavities. Once in a while, they let them have a piece of candy. What I would like to know is who's the one who instigated the addition of fluoride to our water system? The other thing I'd like to know is, if it does pass, are you going to vote to have a law that any restaurant or any establishment that permits the use of our fluoride water to show as a warning that a poison has been placed within our water system? In the newspaper this morning, it showed that in Petaluma, they're concerned about this creek where they want to have purity in the water. And if anything goes into the water system, we have about 6 different state agencies come around to see what they can find about any impurity in that system. So I hope that all of you vote against the addition of fluoride in our water. Thank you.
Thank you. James Bennett. After James, we have George Hebert, Sean Calloway, Lisa Down Marble.
As somebody whose life has increasingly become consumed with awareness and recognition and resistance of UN Agenda 21 Sustainable Development, I am grateful for fluoride, because fluoride is becoming an instrument of awareness and unification. I deplore labels, but even green progressive types are wondering, why is a neurotoxin poison that arrives to a municipality, a treasonous municipality, in a truck with an icon on it with skull and bones, the international symbol for poison? How come it's a poison when it pulls up, but then after that, it's a cure-all for our dental problems? Now, just because an alphabet of different credible sounding groups says something so, doesn't mean it's true. Just because the powers that be tell us the reason we're monopolizing other countries and killing people is to spread, democracy. Just because they tell us that radiating us and giving us chemotherapy cures cancer when they hoard cures, just because the World Health Organization and all these other groups tell us that vaccines are good, just because they spray us like cockroaches with chemicals and say it's to mitigate anthropogenic global warming, just because we're told lies doesn't mean we're going to believe it. People are waking up. The exponential nature of the consciousness is spreading, and people are starting to wake up. And this warms my heart to see these people here. It's poison. It's toxic industrial waste. It's poison. Simple.
Thank you. George Herbert. George left. George There you are.
Oh my. My name is George Hebert from 2 Quixote Court, Santa Rosa. And this is my water bill for my use. Exaggerating, I say I use 4% for drinking and cooking. The other 96% goes to, well, it goes to the sewer, and from there, where does it go? Part of it goes to my garden because I like my fresh vegetables, and I feel great because of that. Mrs. Gadachi and Dr. Silver are committed to what they say is social justice for poor children, children of color, and children of Hispanic parentage. There are many more effectual treatments to be considered, and you've heard them all today, costing a lot less money. Hey, more potholes if you don't spend it. I want this potholes to be cleaned up a little bit. Not being indebted to a foundation, less county bureaucracy, and an honest social justice. Major Jail Teckle rejected fluoridation for the city of Napa. None of the Napa County water systems fluoridate their water supplies. The cities of Napa County have indicated water customers can make individual choices. My goodness, individual choices on fluoride used orally widely available, over-the-counter fluoride supplements and toothpaste. Residents of Marin County are now mounting a resistance to fluoridation to the water supply, which they already have, but now they're getting tired of it. Many countries reject water fluoridation. Belgium, Brussels, that controls the Eurozone. This water treatment has never been of use in Belgium and will never be into the future. The main reason for that is that the fundamental position of the drinking water sector that is not a task to deliver medicinal treatment to people. Now this is your responsibility. I want clean water, and I thank you for giving that to me. But do I need medicine in my water? No, thank you.
Thank you.
Lots of other treatments.
Thank you. Sean Calloway. Sean Calloway. Lisa, is it Lisa Dawn Marble, or you, Sean?
I'm Sean. Good afternoon. I brought with me a package of toothpaste, Fluoride, Sensodyne. Just wanted to read the back real quick. One of the warning signs says, keep out of reach of children. If more than used for brushing is accidentally swallowed, get medical help or contact a poison control center right away. 26 years ago, my mother died at an early age of 41 of cancer, and ever since then, I have been following and educating myself on environmental issues just as a regular citizen. I find it actually appalling that the folks over here promoting or proposing fluoridation of water call it a social justice issue. Maybe actually ironic, I should say, because I actually believe it's a social justice issue as well, and that I demand safe and clean drinking water, okay? It is an outrage to consider this toxin, as everybody has talked about earlier. It is toxic waste. It's not the same as a fluoride that's natural in the water. This is different stuff we're talking about here, okay? This is a progressive-minded county, and it's appalling. The 10 years ago, this issue came to onto my lap, and I'm standing here right now defending this. It's unbelievable. I think it's Patricia Dine says on her website, fluoridation of water is like drinking sunscreen in the hopes you won't get sunburned. It is unnecessary, it is unsafe, and it violates our rights to safe and clean drinking water. It also said it's more toxic than lead, I read today. So I advise you guys to, get educated, read the opposition, have some common sense. Look, there are solutions that people have talked about today. There's topical treatments. There are solutions, okay? And I see my red lights going off here, but I just really wanted to stand up here to say, and there's 100 people behind me, friends in my community that would love to be here if they could, but it's a work day. Thank you very much.
Lisa Dawn Marble. After Lisa Dawn, we have Marilyn Joyce, Bob Rousen, and Brenda Edelman.
Hello, supervisors. All of you have brushed your teeth, I assume, and I just know you have many, many, many times. And on the tube of toothpaste, I think you remember having seen that it recommends a pea-sized portion on your toothbrush. It also says for parents of children under, 6 years of age or under, to watch your child while they brush their teeth to make sure that they don't swallow. And if they do swallow, just a pea size of toothpaste that has fluoride in it, to call the Poison Control Center and to rush your child to an emergency room. That's just a pea size of fluoridated toothpaste. Now, we in America have, for decades, have had the medical standard of informed consent by each individual person being treated for therapeutic purposes. In Sonoma County, certainly each individual does not have informed consent, and as a whole population, we do not have informed consent of the long-term effects of fluoride on our individual human bodies. Now, the purpose of fluoride is the assumed effect of having improved oral hygiene. That's just on one part of the body, the teeth. How about the rest of the body? The majority of the effect of the body, if in fluoridated municipal water, is not for the few seconds that we swish water around in our mouths once or twice a day. The majority of the effect of fluoride is being absorbed into our pores through showering, the steam in showers, baths, and in reconstituted beverages, juices, soups, coffee, tea, anything made with tap water. Into our pores and consumed orally, we have fluoride, and there is a condition called toxic fluorosis. It is the gradual buildup of fluoride in the system of a human.
Thank you. Marilyn Joyce.
Thank you.
Good afternoon. My name is Marilyn Joyce. Disclaimer, I worked for the California Dental Association for several years, producing their monthly journal. So I have high standards for my dentist. A few years ago, I had extensive work done in my mouth, and it left a couple of my teeth sensitive to pain, to hot and cold and sweets. And my dentist said, use a fluoride wash or get a toothpaste with fluoride in it, something that you can use for a couple of weeks on those areas, and it will deaden the pain. And I did that, and it worked. He explained that the bone cellular structure is tubular, and so when you use the fluoride, it fills up those little tubes. You don't want to do it too much. You just want to get the surface so that that those sensations can't penetrate to the nerve. And then we talked about water, and he said fluoride in drinking water, it works the same way. It fills up those tubular bones with a mineral, and it toughens the bone in the same way. But rather than making the bones stronger, it actually makes them brittle. He says especially someone with osteoporosis, which does run in my family, if they fall and they break a bone, instead of it breaking and being able to set, the bone shatters, and it's very hard to put back together. A lot of powdered pieces. So, at our house, we filter both our water and our drinking water and our shower water. To filter out fluoride, we have to get a separate add-on filter. Costs $60. Only lasts for 6 months. I'm thinking that limiting the consumption of sugar and sodas is going to make a big difference. Kids don't drink tap water. Very few people drink tap water. So that's
Thank
my
you.
suggestion.
Bob Rousen.
Good afternoon. My name is Bob Ross, and I'm the General Manager for the Grayton Community Services District.
I'm a grade 5 wastewater treatment plant operator with 42 years of operating and consulting experience in wastewater and water treatment, industrial waste programs, wastewater laboratories, and Clean Water Act litigation. I also have 26 years teaching water and wastewater treatment at Santa Rosa Junior College, and I've been teaching the operators who will be doing the operating and practicing the medicine on all of you rather than your dentist or your physician when you decide to put this drug in your water. Grayton is lucky because its drinking water comes from wells. However, Grayton receives wastewater from Forestville from time to time, and they derive their water from Sonoma County Water Agency, which would be affected by this program, hence I'm here. It's got large potential for damaging our beneficial reuse program. Fluorosilicic acid is an industrial waste product, hazardous waste. Grayton's NPDES permit requires source control to prevent the pass-through of pollution and the damage to beneficial uses of our reclaimed water and surface water discharges. So we're concerned, and we're concerned about costs as well as the impacts. So Grayton opposes fluoride. Fluoridation will cause environmental damage. Fluorine is toxic at 0.5 milligrams per liter to aquatic organisms. EPA limits are 0.2 milligrams per liter, and you're proposing 0.7 milligrams per liter, which will pass through to surface water and cause damage to salmonids and other aquatic organisms. It's acidic, causing corrosion of copper pipe, copper itself also being damaging. And so this is going to subject dischargers to fines, lawsuits, and other costs. Toothpaste has 1,000 to 50. I'm sorry. Thank you very much.
Thank you. Brenda Edelman.
Brenda Edelman. Basically, I agree with the comments of the people who expressed concerns today about fluoridation. I think we're all agreed that there's a problem. I think the issue is what to do about it. It concerns me that the experts who have given testimony today have not differentiated between the different types of fluoride, either chemically or in terms of the variance in effects when you apply it externally as opposed to when you ingest it internally. And there's a huge difference. And believe me, I could load up your computers with so many scientific studies that express concerns about this from bona fide scientists who have just as many credentials as the people who have been before you today, and maybe more. One of them is coming to Santa Rosa the end of March. I would like to leave some flyers with you. I hope that you will come to hear another point of view from a toxicologist and a chemist. I think that sodium fluoride is, I believe, the one that's most often used, is an endocrine disruptor. And the UN just this last week called hormone disrupting chemicals a global threat. Many of the diseases you heard referred to today are connected to endocrine disruption, which has a major impact at very low doses. And it's a very serious concern. I too am deeply concerned about medicating people against their will. I know there are lots of sad stories about people with dental problems. I think the problem is really a poverty problem and an educational problem and a need to improve the information about dietary concerns and the need to reduce the amount of sugar in the diet. Thank you very much.
Thank you. Stephen Fullerell. After Stephen, we have Marlene Lilly, Larry Hansen, Ellen Van Allen, and Lou Tavares.
Members of the board, my name is Stephen Fullerell. I have lived in California for half my life and in Sonoma County for 28 years. I live in Santa Rosa. I have a 6-month-old granddaughter who lives with us. I'm also one of the co-founders of the Sonoma County Water Coalition. The Water Coalition does not support fluoridation, and most of our members oppose it. The opposition to fluoride has been understated in the Department of Health's report. There is one petition on change.org. You can find it by Google it or by searching fluoridation Sonoma County. One of the petitions has been signed by 543 people. There's another petition signed by 379 people. So it's nearly 1,000 signatures in 9 weeks. The proposal before you today is the equivalent of using a sledgehammer to do surgery. Many children with poor dental health, particularly low-income Hispanic children, live in areas that have private wells. Or alternatively, they don't trust tap water. Magdalena Ridley from Roseland has given me permission to quote her today. She is a law student, so she's not able to be here. She, in a personal communication to me, says a lot of low-income families, especially immigrants, purchase water from little machines. You see them in front of our shops. People don't completely trust the water supply to be pure, so that's why they don't use their tap water, don't use tap water. She goes on to say people buy the bottles of water in huge packs from Costco. I know several people who literally only drink bottled water. Lots of kids I know think tap water is weird. I also have a personal communication from Don McInhill, the Russian riverkeeper, who says that his children go to a K-8 Spanish immersion program, even in Windsor, where they get SCWA water. His children tell him that the friends they know only drink bottled water. So this program will not deliver water to the people who need it. And I advise you, before you approve $317,906 worth of studies today, you first do the socioeconomic studies to determine that the delivery mechanism you have gets the remedy to your target population.
Thank you, Steve. Marlene Lilly.
Hi, I'm a taxpayer and a 26-year resident of the Junior College District, the 3rd District. And I'm mostly concerned for myself with osteoporosis because I was diagnosed with low bone density in 2005, and I've spent the last 7 years rebuilding my bones. And I don't want any substances put in the water that I drink, and I drink tap water all the time. I have some with me that will compromise my bones. And John Lee, who was a Sebastopol resident, wrote several good articles about how fluoride causes osteoporosis, and you can get them online by just Googling osteoporosis and fluoride, and he'll come right up at the top of the list. I'm especially interested also in the social justice issue, because just in the last couple of days I found what Tamara was talking about, which is not the League of Nations, but LULAC, the League of United Latin American Citizens, the oldest Latin American organization in the United States. They came out with a resolution, the best written thing I've read on it, whereas current science shows that fluoridation chemicals pose increased risk to sensitive subpopulations, including infants, the elderly, diabetics, kidney patients, and people with poor nutritional status, and whereas minority communities are more highly impacted by fluorides as they historically experience more diabetes and kidney disease, and whereas minorities are disproportionately harmed by fluorides as documented by increased rates of dental fluorosis, disfiguration and discoloration of the teeth. And they go on to say that they're trying to get it out of the water in San Antonio. And Andrew Young, the former mayor of Atlanta, has written letters to all the Georgia legislators asking that fluoride be taken out of Atlanta water because 61% of the inner city children in Atlanta, which has been fluoridated for 50 years, have tooth decay just like they do in Santa Rosa.
Thank you, Marlene.
So there's a good study for you right there. Look it up online. I gave you
Thank you,
all
Marlene.
this documentation. You've got it in front of you.
Thank you. Larry Hansen?
Hiya. I've been to a couple of the other meetings that have been held, and I am concerned with the safety of ingesting fluoride. And listening today, as a Kaiser member, I'm very disappointed with hearing their position. But today I'm here representing California River Watch, and we're concerned with the impacts of fluoride, specifically to wastewater. Because without the plans to defluoridate wastewater, fluoride will enter into wetlands and streams, waters of the state, and may be in the violation of the Clean Water Act and the Endangered Species Act, which, as you probably all know, coho, steelhead, chinook, and fairy shrimp, among others, in this county. So I have read the Sonoma County Fluoridation Assessment Draft Report, and in it that they claim safety for the environmental impacts. One sighting referred to the CDC website where an independent peer-reviewed study was not found. And there was another sighting that was completely missing in the report. There's no sighting whatsoever. When an undertaking is proposed that is substantial, I would expect to find compelling studies and would implore each of the supervisors to read the studies on both sides. If you do not have time, have your staff do it, but the studies must be read and evaluated with the important criteria in mind. By the way, that it is clear that the evidence supporting ingesting fluoride is not rock solid, that it was mentioned earlier. Thank you.
Thank you. Ellen Van Allen?
Hello, I'm a resident of Sonoma County since 1969, and my husband and I raised our children here. Our daughter and son had sealant applied, and our daughter has had only one cavity since. That was when her permanent teeth came in. I'm appalled that in a county which is pleading fiscal difficulties and planning to let a large percentage of the roads deteriorate, that they're considering $8.5 million in fluoridation, I guess 300,000 in studies I hear now, and even worse, because I assume some of this is outside funding, to commit almost $1 million a year in upkeep. My dentist, when I was young, pointed out the window to a truck full of soda and said, "There goes a truck full of cavities." It's well known that apple juice in bottles will rot the teeth before the baby has any chance to even have fluoride, unless it's in their formula. And if it's in their formula, infants who are fed formula made with fluoridated tap water will receive up to 175 times more fluoride than breastfed infants. Infants 0 to 6 months old, the smallest and most vulnerable in our population, were completely excluded from risk calculations and Health and Human Services proposals. So putting fluoride in the water causes very uneven dosages, which I think is one of the major issues for it. I am completely in favor. I'm appalled to hear about the dental health of children in our area, and I'm completely in favor of steps 1 through 4. And it seems to me that the $8.5 million, if that were available, and certainly the $1 million a year, would go a long way towards both education and topical application of fluoride, which I believe is safe, whereas there are certainly, from my perspective, questions about fluoride in the water. Thank you for considering this.
Thank you. Lou Tavares? And Lou, I gotta apologize because this card does say Lou Montgomery, and the other one was your card, so I apologize, but get the opportunity here.
That's quite all right. But one thing about speaking after so many people have already been up here is a lot of things have been said or things that I would have said. So I would like to support the people that spoke here today with a sense of sanity, and that's that they're asking you to reject this fluoride proposal. And there's, seems to be between Harvard and San Francisco, the University of San Francisco. So I'd like to read to you from a Harvard study that finds fluoride lowers IQ, and that's published in a federal government journal. And also that fluoride accumulates in the body. Even low doses are harmful to babies, thyroid, kidney patients, and heavy water drinkers. Go figure. Now, it was mentioned earlier that cigarettes have a warning label. And then another fella comes up and he reads you the warning label on a tube of toothpaste, fluoridated toothpaste. The information's there. It's known. You just have to use the right sense to make the right judgment. Now, the government is going to make an issue and tell us that we have to have fluoridated water. Did you ever hear that government doesn't solve problems? Government is the problem. And I was here when this council voted to start this process in Sonoma County. And I remember Mr. Rabbit and Mr. McGuire speaking after the vote that they were so happy to be a part of this groundbreaking day, and yet I know that neither one of you are experts in this issue, so it really is important that you study this issue completely. Because none of us are experts, but a lot of us are doing our homework. Thank you.
Thank you, Lou. Jane Nielsen. After Jane, we have Vesta Copestakes, Jeff Millar, is it, or Miller? And Carrie, we'll just go Carrie Wheaton.
Good afternoon. I'm here representing the Sebastopol Water Information Group, a member of the Water Coalition. SWIG opposes fluoridation in Sonoma County. We know that science is not a static entity. Current science, several generations after initial U.S. fluoridation, seems to be turning up negatives about fluoridation. We're concerned about that. We certainly are concerned about the health of poorer kids in the county, but we don't see the data. If the results were as clear as the people who have testified here to what they've seen, the study results should be much clearer than they are. They should show much clearer ratios of improvement than they do. The statistical analyses should be much less mixed. Now, much has been said about Europe and fluoridation. Many European countries do not fluoridate their water or milk or salt, and their improvement in dental condition for 12-year-olds is just about the same as the countries that do fluoridate. So there must be something different at play other than forcing people to ingest fluoridated substances. So I would follow the Environmental Working Group, a very reliable organization for environmental and health issues, telling you what you want to buy and what you don't want to buy for environmental health and your own health. They say topical application is the way to go. That's where we ought to spend our money. Thank you.
Thank you. Vesta Copestakes.
I used to be thoroughly convinced that fluoride was really positive. I lived in an area with well water. I didn't have fluoride in my water, so when I was pregnant with my daughter, I ingested vitamins to make sure that her bones would form, her teeth would form with fluoride. When I gave birth to her and I breastfed her, I had liquid vitamins that I gave to her to make sure her teeth formed solid. Unfortunately, and this is all doctor prescribed, right? Unfortunately, what happened is her teeth had little holes in them, thousands of little holes in them, and then I had to have the fluoride external treatment to it to seal them up. Nowadays, she has brittle bones, and it's like, oh my God, is it my fault that I did this, that I took my doctor's advice because it was almost 30 years ago, and it was so firmly believed that this was good? My daughter has porous teeth and porous bones. I don't know, maybe it's true, maybe it's not. But the bottom line is I made a choice. My choice was to fluoridate my daughter's body for her teeth. But if the water has the fluoride, it's no longer a choice. It's everybody has to have it, or they go buy bottled water. So if you fluoridate the water, you're taking my choice away. Then I cannot take water from my tap. I have to buy it by bottle. There's also a program in Sonoma County, it's called Rethink Your Drink. And one of the reasons this program exists is because people are using soda as their substance to drink instead of water. And what the Rethink Your Drink people have said is that the people who won't buy bottled water because it's more expensive than soda. So they go out and they buy the soda to get their water, and they won't drink tap water because they don't trust the tap water. Many of these people come from countries where the water is not clean. So if you expect to get it into their bodies, it's not necessarily going to come through the tap. Please give people a choice, and give these people a choice as well, and educate them. Take the $8 million to establish the system and the $1 million that you're using to maintain it, and put the dental clinics like they are at our schools. We have school dental clinics, we have dentists giving free dental clinics. Put it into that instead, please. Give people the choice and the education.
Thank you. Jeff Miller. After Jeff will be Carrie Wheaton, Barbara Dion, Marie Mulligan. Thank you.
Hi, I'm Jeff Miller. I'm a pediatrician and a Sonoma County First Five Commissioner. I've been taking care of kids since the 70s, as well as been reviewing literature about fluoride since the 70s, because this subject came up all the time in my practice. And I just want to say that I strongly support the recommendations before you, including the fluoridation of our water. And also thank you for proving that democracy works even if it's messy.
Thank you. Carrie Wheaton. I didn't want to butcher them.
That's okay. It's Cacavo.
Thank you for that.
Hi, my name's Carrie Wheaton. I'm a Phi Beta Kappa graduate of Amherst College with a master's in clinical social work and a health and nutrition researcher and advocate, a school volunteer, and I reside in Sonoma County. And I'm not a conspiracy theorist, nor do I wear a tinfoil hat, just establishing that. But I was aware of the dangers of trans fats 25 years before the state of California did anything about it. And I'm very aware of the role industry often plays in decisions affecting our health and the unnecessary suffering that can result, not to mention medical costs to the county and state. There's obviously contradictory research and good intentions on both sides here, and I implore you to look closely at the research, not just, what this lovely, clean, and, spiffy committee put together with their presentation, but please read the opposing research. I'm opposed to the mass fluoridation of water, which is really a medication of all of us for many reasons that have been mentioned. The Harvard study, UNICEF, and many other reputable sources have come out against it. And the source of this fluoride being industrial waste is very concerning. It's fluoride plus. We don't know what else we're getting in there. And there is an industry push for this, and there's a cozy relationship with the American Dental Association, and that has to be looked at. I'm not paranoid. This is a real fact of life in America these days. I oppose an expensive evaluation of this issue, and I want to make a big plug for prenatal nutrition. If we have 6-month-old kids having massive dental programs, they did not get enough minerals in utero. I want to make a plug for Weston A. Price's research. He's the dentist mentioned earlier who researched native diets 100 years ago and documented people with photographs of healthy, perfect teeth from people eating native diets. Trade brought refined foods and tooth decay and all sorts of other problems along with it. Okay, please look at his research, westonaprice.org.
Thank you.
And I have some materials.
To the clerk and materials. Barbara D. Ione.
Hi, my name is Barbara Diona from Forestville. I don't have a big opinion about the toxicity of fluoride, but as I'm listening to everyone's presentation, and I've looked a bit online myself, it seems like there is a lot of controversy about this. I would urge you to hold off and vote no on it. It seems like the stories that I'm hearing about the early childhood problems with dental, the dental problems, I think that when you have kids that are that young and they're getting operations on their teeth, you're not getting to them with the information and, you know, early education, and also the access to care seems like a big one. I don't think it's a good idea to use the money for this because we have a lot of water issues that need attention. For instance, our wastewater. If we could clean up our wastewater so that it was just water, we could do all kinds of things with it. Now it's very limited because we don't know if we're spreading toxins over the land when we use this water. So with all the things on water that we really have to resolve, I hope that you won't vote for this because it's a lot of money, it's not proven, it's controversial. Thank you.
Thank you. Marie Mulligan? She went already, oh, great. Colleen Fernald?
Sorry, you didn't give me a heads up on that. So, I really look forward to working with the health department on many other issues to keep us healthy when we can move past this wedge issue. And one issue, I agree with everyone before me who is against the fluoridation of our water supply without consent or vote. So I'll try not to go over too many of the same points. So now that we recognize how important organic farming is here, both to keep us healthy and for our economy, are you adding up how much organic farming brings to your revenue here? What will happen to the certification of the organic farmers if they're not on wells and they have to take water agency money? Water. What's going to happen to their organic certification? We don't need to study that. We don't need to pay for that. When I was on Medi-Cal and my children long ago, when it wasn't not so strapped, I could barely find any dentist that would take it. And then when we did have cavities, and our only option was getting it filled with mercury, trading one bag for another once upon a time. Now there's less money, and there's many people in this population who are not getting Medi-Cal because we make too much, but we don't make enough to have dental care or health care. So I have to be really educated. Now, table salt, the difference between, you were talking about the constituents of the natural versus this pharmaceutical or industrial fluoride. So table salt, we learned, is not really healthy. Even the major brands like Lay's are switching to sea salt, but the seas are polluted from Fukushima nuclear disasters to the Gulf core exit petroleum disasters. So to get my trace minerals, 84 of them, I don't use sea salt. This is Himalayan sea salt, ancient minerals. I supply the dosage, and if I need something therapeutic, lithium for mental health, if going through my grief, I can go to my doctor and get a prescription for a natural substance in a therapeutic dosage, or I can go to Oliver's Community Market, 5-HTP. I can find things that go into my body, even for pain, arnica, and they're not going to hurt the fish when it's in the wastewater. My choice. Water agency will be liable on their own with your recommendation for the lawsuits.
Thank you, Colleen.
Oh, there's so much more.
Let's
continue this discussion without lawsuits and just fun.
Thank you.
More access to low-cost dental care. Thank you.
Is it Dines? Yeah. After Patricia, we're going to have Carol Taylor, Andre Hermstad, Darren Shipley.
Ready for me?
Yes.
I gave each of you guys a packet. My name is Patricia Dines. I'm a professional writer specializing in community issues. I've written 7 books. I do a newsletter, a column called Ask Eco Girl, government reports, and articles in a wide range of periodicals. I've been studying water fluoridation for 15 years. I also have an email list for folks who want to stay updated on fluoride. I'm strongly opposed to fluoridating our water. I believe that the recommendation to fluoridate our water is based on outdated information that has been disproven. And there's kind of this momentum from the past beliefs, but they are not supported by the current facts. It's very soothing when we have an expert say to us, oh yes, this is the cheapest and the most effective way to help the people with their dental health, and we care about their dental health. But unfortunately, this information is out of date, and the experts are refusing, the mainstream experts are refusing to look at that information. But there are many also qualified experts who have provided strong, high-quality scientific information demonstrating that fluoridation does not improve dental health and that it does harm our bones, it does cause bone cancer and a wide variety of other health impacts. I've included professional statements of medical professionals against fluoridation in there. I provided the EPA union statement against fluoridation in there. They tried to work within the government, were not heard, they had to go public, they went to court. I've got the statement of LULAC, the largest Latino organization in the United States, strongly opposed to fluoridation. There are many people outside the mainstream medical organizations that are speaking out against fluoridation, and in fact, some people within those organizations as well. There's many medical professionals on that list. It's soothing to want to believe the experts. Unfortunately, though, we've too often seen our experts claim materials were safe, and it wasn't true. From doctors and ads saying smoking is good for our health, to DDT being sprayed on school children, to PCBs being used worldwide, and even the ADA consistently saying the mercury amalgams were safe long after the evidence proved otherwise. And meanwhile, many people are harmed. We pay the cost. So Sonoma County is an innovative county. We don't just follow the mainstream. We think for ourselves. You have a responsibility to protect our people, keep our water clean, and really pay attention to the science. I hope this information helps you do that. Thank you.
Thank you, Patricia. Carol Taylor?
She left.
She left. Andre Hermstad?
Good afternoon. Thanks for having me. My name is Andre Hermstad. I'm proud that Sonoma County is well known in sustainable agriculture. As a consumer of mostly organic food, I believe that we should have a choice when it comes to the food that we put in our bodies. If this atrocious proposal passes, how will it affect organic farmers and consumers? This fluoridation proposal will affect our right to buy locally grown organic produce free from fluoride. I'd like to say that fluoride can have its benefits when it's pharmaceutical grade, applied topically, and in controlled doses. When it's ingested, however, it has a completely different effect on the body. Even in minute amounts, it has been linked to increased risk of bone fractures, cancer, arthritis-like symptoms, decreased IQ, and pitted teeth. Pharmaceutical grade fluoride is not even the same fluoride used in water fluoridation. It is an industrial waste product from the wet scrubbers of the fertilizer industry called hexafluorosilicic acid. What would otherwise cost the fertilizer industry roughly $7,000 a tanker to dispose of, they instead sell it to the cities for $265 to $722 a ton. The fertilizer industry invests millions in grants and lobbying of government officials to promote fluoridation. The caustic nature of this substance actually causes copper and lead to leach from soldered pipe joints and fixtures. Another point is that if fluoride is supposed to prevent tooth decay, then I would think it would classify it as a drug by law. Yet the FDA has never produced a single randomized clinical trial to demonstrate fluoride's efficacy and safety. The studies that launched fluoridation decades ago have been dismissed by experts for highly unscientific methodology. Over the past 50 years, the rate of tooth decay has actually dropped at similar rates in Western countries, most of which have never fluoridated their water. Only 8% of the world's nations fluoridate their water to this day. This is definitely a human rights issue, since we should have the right to consent to being medicated. Your target group is young children, but this will affect over 250,000 people, many of whom have been advised to avoid fluoride, such as infants, anyone with impaired kidney functions.
Wrap it up, Andrew.
According to okay. I hope you guys make the right decision based on unbiased facts as opposed to an outdated, cheap fix for a growing problem. We'll be monitoring this situation intently, and I hope you don't choose to disregard all the evidence, and I'd like to make sure you guys are held accountable for our health.
Thank you very much.
Fluoridating our water supply would send us all to an early grave and disease.
Karen Shipley?
As our constituents, you represent us, and I would
Thank
like
you, Andre. I'll let you go over there. Don't
stop
push
in
it.
its tracks. People
Thanks.
spoken. Thank
Darren Shipley.
Good afternoon. I cut this down out of respect for everyone's time, so I'll cut straight to the point. The main argument I want to make is that the only thing that should be put in water is to treat the water and to make it more drinkable, make it drinkable and non-toxic, not to medicate people. Medicine should be a personal choice made for personal and cultural reasons, not force-fed to the public. Now, there's a lot of scientific research out there that I'm going to skip because I know you have access to the same and more information that I do from scholarly websites about mental retardation, etc. But the bottom line is that more research needs to be done, and there is a dangerous possibility of toxicity. So to close out, I just want to say that do we really want to mandate medication for our people, especially with a substance that has evidence of serious ill effects? I propose that we save this topic until more research has come across that can prove the substance one way or the other. Until then, who would want on their conscience the possibility that they mandated a poisoning of thousands of people? Thank you.
Thank you. Maxwell Church. After Maxwell, we have Kristen Bartquist, George Noble, Katrina Phillips.
Hello, board. Thank you for your time, your patience. My name is Maxwell Church. I'm a massage therapist and health educator. I'm also a fifth generation Sonoma County. Born and raised here in Santa Rosa. I used to sit on my great-grandmother's lap, and she lived until ripe 92 years old with all her teeth in her mouth. Yes, the time have changed since my great-grandmother has been around. Tooth decay has increased, and the consumption of refined foods has also increased. And so I'm going to take this moment to read from Healing with Whole Foods by Paul Pitchford. Fluorine in food. Fluorine and its components in food are entirely different from chemically produced sodium fluoride, which is put into public utilities water. Once an element is extracted from the soil and incorporated into plant life, its properties change greatly. Fluorine compounds in food, for instance, have important nutritional functions. The combination of organic calcium and fluorine creates a very hard surface on teeth and also in the bones. That is why, when there's tooth decay, we assume a fluorine shortage. Also, fluorine helps protect the entire body from the invasion and proliferation of germs and viruses. One of the most concentrated sources of fluorine is in goat's milk. Other sources are seaweed, rice, rye, parsley, avocados, cabbage, black-eyed peas, herbs high in fluorine include juniper berries, licorice, lemongrass, bancha tea twigs, and other tea plants. So I ask you to support real change. As an Ayurvedic practitioner as well, I'm all about inspiring people to be practitioners of their own healing and health. And I hope you would also take the measures to use $8 million to inspire people to heal themselves. Inspire true democracy and people's choice to choose what they put in their body. Maybe just buy, $35 can buy you this book. Buy a bunch of these and give them to low-income families that couldn't afford it.
Thank you, Maxwell.
So please,
thank you.
Think about this before you vote into changing our waters, our water in any way.
Thank you.
Thank you.
Kristen Bartquist. Is Kristen here? Kristen Bartquist. George Noble.
Good afternoon. I too don't want you to take away my right to avoid the fluorides. I decided to use my time to just mention the number of cities that are withdrawing from fluoride addition to their water. They include Los Angeles, Newark, New Jersey, and Jersey City, Massachusetts City, blocking the name, I didn't get that one. And to quote you some other research that I found, 1992 University of Arizona study yielded very surprising results when they found more fluoride a child drinks, the more cavities appeared in the teeth. Only small margin there separates the beneficial fluoride levels from the amounts known to cause adverse effects. And there have been a number of incidences of operator and equipment malfunction. In British Columbia, just 11% of the population drinks fluoridated water, as opposed to 40 and 70% in the other Canadian regions. Yet British Columbia has the lowest rate of tooth decay in Canada. According to a Sierra Club study, people in unfluoridated developing nations have fewer dental caries than those living in industrialized nations. They conclude, as a result, fluoride is not essential to dental health. All Native American reservations, I found this interesting, are fluoridated. Children living there have much higher incidences of dental decay and other oral health problems than children living in other U.S. communities. So now the fluoride proponents are making more modest claims, but not completely giving up on their push.
Thank you.
Why they won't let go, I don't know.
Katrina Phillips. After Katrina, we have Deanna Foldbury, Sue, and Dr. Robert Raven or Rowan? Rowan. You got doctor's handwriting too.
Thank you very much for hearing me out, and thank you for your patience, everyone. This open hearing should not be resting on the tugging of any heartstrings or job titles or what university anybody went to. We need to concentrate on the facts. Here's one very silly fact. I grew up in low income. I am half black. I am 38 years old. I've never had a cavity because my parents taught me how to brush my teeth. Anyone who has ever looked at or has ever prepared a baby bottle with formula, you will see on the label, do not use this product if you have fluoride in your water. What does that tell you? That was added in the year 2006 by the American Dental Association, the ADA. So for those of you who are crying conspiracy theories about some of us who are opposed, I do believe you're the same people who are backing the ADA. I propose that with your $8 million, you could create thousands of jobs in this county. Those thousands of jobs could be educational jobs, teaching children, families, new parents, the importance of dental care, health, and diet. That will greatly improve. I also want to let you know that I really implore you to listen with your ears and not your wallets, because many people do not know this, but up until November 28th and October 24th, 2012, you no longer have a corporate veil, and the government charters have been foreclosed upon. So I implore you to listen to the people, and I have provided you with courtesy notices.
Thank you. Deanna Foldbury? Deanna here? No. Sue?
If I may, I'd like to donate my time.
Sue, we don't do that. It's you or no one.
Okay. I'm here and I'm terrified as I stand before you. We're all in a hurry. We've got kids in soccer. We've got, whatever our busy lives are, and we're forced to make decisions under duress, under stress, in a hurry. And it just scares me to think that we're going to put fluoride in our water. Something that you scrape out of a smokestack and ends up being shipped across from Florida over to here and put in our water. We've lost our instincts, and I just beg of you, please, look at all the evidence. And I do care about people who need to have dental work and aren't able to get it. But this just is not going to be the answer, in my opinion. And the other thing, I agree with everybody, what they've said here who are opposed to it, but I'd like to add that my concern is I'm an organic grower myself, and not only am I worried about the plants, but I'm worried about our soil. We're losing so much of our topsoil and all the organisms that are alive in it. What does the fluoride going to do to it? So please consider that. And in regards to the comments about the conspiracy theory, these people that come to us that point the finger at the conspiracy theory, they're the ones that have been hiding the mercury in the silver fillings. Mercury has been in silver fillings since the beginning of silver fillings, and I find them very untrustworthy. So I hope that you'll take that into consideration too. Thank you.
Thank you, Sue. Dr. Rowan. This is the last card I have. If anyone wishes to speak, please fill out a card and put it over there in the plastic bin. Thank you.
Thank you. I don't believe in titles, but I'll tell you I'm a licensed doctor. I'm doubly board certified and recertified. I write a large national newsletter, and I graduated Phi Beta Kappa from Johns Hopkins University and from UCSF Medical School. You're listening to people like the Pediatric Association supporting this. These are the same people who are dumping vaccines in children, and they've never done a study on the all-cause mortality and morbidity of 36 vaccines in kids versus non-vaccines, and you have an epidemic of autism. You're listening to the American Dental Society that gave us mercury, and we now know that mercury is an unbridled poison. They told us for years it wasn't released. It is released. I deal with adults, not with children. I see an epidemic in my patients of dementia. Well, we know that fluoride added to water leaches more aluminum and lead out of pipes and pots, and we know that aluminum is connected with Alzheimer's disease. Hello, is anybody listening? We have 30,000 different toxins out there, maybe 80,000. Maybe 1 part per million of one toxin doesn't hurt, but suppose you have 30 different thousand toxins at 1 part per million. Now you've got 30,000 parts per million of various toxins, and we know they're not just synergistic, they're exponential. Talk about social justice. I teach my patients, you eat the white man's food, and you eat the white man's toxins, and you get the white man's diseases. Weston Price. Again, you can't tell the difference between osteoporosis and osteoarthritis on an x-ray of the back versus skeletal fluorosis. There's such a narrow window of safety here. If I was to practice medicine the way you guys are going to practice it, by giving fluoride and not monitoring the dosage of this drug, and I did that to my patients, I'd have my ticket jerked in a heartbeat. Thank you for listening.
So, again, I'll ask one more time, if there's anyone else, that's the last card I had, is there anyone else that wants to speak before we close the public hearing on this item? Seeing no one rise, let you know that we have closed the public hearing on this particular item, and we'll come back to the board. I'm sorry. If we can take a 5-minute break, and understand that people have been sitting here drinking water.